Hello and good day, my friends. I hope all of you are in good health and doing well. This video today is about the value of vitamin D. And I want you to hold on and just spend some minutes watching this video. And at the end of the video, I can assure you that this video and watching the video will make a difference for you and will make a difference for your health. So, the other thing that I want you to know that everything I will mention can be fact checked, and it's not a personal opinion, and it's not a debate amongst commentators, politicians, or policymakers. This is medical science that has been proven over and over and been published by peer-reviewed journals and institutions. So, everything about vitamin D that you need to know in about 5 minutes. Over the past 10 to 15 years, we have learned the value of vitamin D, not only in bone disease, but also in hypertension, in diabetes, in all sorts of cancer prevention. So good levels of vitamin D have a very favorable and good effect and protective effect against those. It's good for depression. It is good for anxiety. It is good for sleep. It's good for obesity. It's good for rheumatoid arthritis. It's good for multiple sclerosis. It is good for asthma. It's good for people who have COPD, people who have the flu, recurrent pneumonias, and so forth. So that issue has been settled and plenty of research to support it and talk about it. The issue that we have learned over the past 6 months is about the value of vitamin D for COVID. So if you go to any search engine and put COVID and vitamin D, you will find out that having adequate blood levels of vitamin D is protective against serious COVID infection. So it will make your COVID disease a mild disease and a home disease rather than an ICU disease and rather than a hospital disease. So good levels have a favorable effect on how you will respond or how you will act with COVID. Now, what I would recommend to you as a doctor to my patients are 3 things that you have to do. And these are not general things, these are serious things that you have to do. First and foremost, contact your healthcare provider and ask them to do a blood level of vitamin D for you. It is extremely essential that you have levels above 35 to 40. Those levels are very favorable to a mild course of COVID. And if your levels are low, you are at risk of having serious COVID infection. So the first thing is contact your healthcare provider. Now, while waiting for an appointment and for a test and for a test results, I would encourage you, when you hear that video, start taking vitamin D3, 5,000 units once a day. Take the soft gel or gel caps because they are stored in oil. Do not take the tablets. Do not take the gummies. Do not take the capsules. The absorption is not as good. So I would encourage you to take the soft gels or gel caps and take them with a teaspoon of olive oil. That will enhance absorption, and olive oil has a good favorable effect on immunity as well. So start taking those. So if your level comes back very high, it's great. You can scale back on the dosage to what is recommended, which is 2,000 units a day. Or if your level is low, you had not wasted time until you get your level to a good level. So start today. Get tested, not for COVID. Get tested whether your vitamin D level is adequate or not, or start making the arrangements and start taking vitamin D immediately. That will give you a very mild course of COVID if your levels are in the 30s and 40s range, rather than if your levels are low. So start today. Spread that video. Google COVID and vitamin D or use any search engine and see the data is overwhelming from northern Italy, from Spain, from Ireland, from Sweden, from the Philippines, even from China, and most importantly from the United States. The data is there. I am doing merely is sharing that with you, raising your awareness about how you have to take care of your own health. And let's leave this debate between politicians, pointing fingers, punching each other on TV, on national news, on Facebook. That does not help you as a patient. It doesn't. What helps you is really science that is well known to protect you and to boost your immunity. And last but not least, get exposed to sun and get exposed to open air and really get a tan. And the reason is we no longer live in a sunny environment. We live in a roofed environment. We have changed our lives in a way that we are overweight. Our diet is not as healthy. So almost 40 to 50% of adults have some form of vitamin D deficiency. Get tested with levels. Don't wait. Start taking vitamin D and get out and get some sun to help you improve your chances of having a light and a mild and a favorable course of COVID. With this, I think I have made it very clear of the value of vitamin D, not only with everything, but also with COVID. I wish you the best. Stay safe. Yes, I am Dr. Rifai, and follow us on the Virtual Nephrologist.